The first thing we discussed was the anatomical position, which is used as a point of reference for clinicians and first responders. The body is upright, no matter how you find a victim or a patient, and recall especially the position of the hand and the arm. Palms are facing forward in anatomic position, and thumbs are facing laterally or outwards. The reference of right and left always refers to the patient's right and left. Talked about next, superior and inferior, anterior and posterior, medial and lateral. You should be able to comfortably come up with a sentence referring to each of these with 2 points on the body. Recall how anterior and posterior and ventral and dorsal are indicated differently in a biped and in a quadruped. So anterior, in a biped like you and I, the anterior surface is facing forward and is indicative also of the ventral body surface. Whereas in a cat, its belly or ventral surface is pointing inferiorly. And his back or dorsal surface is pointing superiorly, where your back or dorsal surface is pointing posteriorly. Terms are proximal and distal, which again are used only as for 2 points on the legs or arms, and superficial and deep, which the most superficial organ we usually mention is the skin. Helpful, and I encourage you to examine here on the right. The 3 planes of space, important in radiologic imaging. Again, we're using the term mid-sagittal, not median. So you have a transverse plane, which separates you into superior and inferior halves, a frontal plane, which separates you into anterior and posterior halves, and the sagittal or mid-sagittal plane, in this case, separating you into right and left. And again, these will come into play when we talk about imaging technologies. Recall that if the sagittal plane is exactly in the middle, again, we refer to that as the mid-sagittal section. The other word for frontal, if you recall, is coronal. And I would like you to know that. So we mentioned these. Oblique, you're not responsible for. The regional body anatomy, I don't know how helpful this will be on a video. Nasal is nose, oral is mouth, cervical referring to the vertebrae is the neck, frontal, orbital, buccal for cheek, and mental for chin. Or down on the thorax, we have the acromial area, the tip of the shoulder, axillary area, in the armpit area, abdominal above the belly button, brachial area above the elbow, antecubital area where you might draw blood when you donate or when you have a medical exam. The antebrachial area is the forearm. Pelvic is below the belly button or navel area or umbilical. Carpal, like carpal tunnel syndrome. Palmar and digital. Sternum or sternal area, thoracic, and mammary. Make sure you can differ. Coxal is hip. Inguinal is groin, which we discussed. Femoral is the femur area. Fibular, where you have a fibula. The pubic area, it should be obvious. Patellar, crural, tarsal, and digital. You have otic for ear, occipital for the base of the skull. Reference area, vertebral, scapular, dorsal, and lumbar. Our other points of interest back here include olecranal, which is the back of the elbow, and the sacral, which is the tailbone area. We have the gluteal or buttock area, perianal area, popliteal area, sural, calcaneal, and plantar. Posterior. This slide I think was interesting just to point out that we know, if you look at 2 people, they look physically different on the outside, but also on the inside, we are all also physically a little bit different. So if we were to strip your skin and look at your muscles, no 2 people would look exactly identical. The body cavities is the next important topic to note here. You have two principal body cavities, the dorsal cavity and the ventral cavity. Again, one lying towards the posterior, one lying towards the anterior. The dorsal cavity is further subdivided into the cranial cavity, which contains the skull and the brain within that, and the vertebral cavity houses the vertebra, and within that, the spinal cord. The ventral cavity has also two subdivisions, the thoracic cavity, which is further subdivided into the pleural cavity, which houses the lungs, and the and the pericardial cavity, which houses the heart. And the abdominal pelvic cavity is divided into, relatively obviously, the abdominal cavity and the pelvic cavity. In the abdominal cavity, you find the viscera here, the digestive organs, like intestines, for example. And in the pelvic cavity, you have the bladder and the reproductive organs, principally, or only, I should. So we have some pictures here. Here is your dorsal body cavity subdivided into two subdivisions, and your abdominal pelvic cavity here is already broken down for you into the abdominal and the pelvic cavity. Or I guess this is your ventral cavity, which here's your abdominal pelvic cavity, and then your thoracic. Here's another view. So the ventral body cavity, again, divided into the thoracic cavity, which is further divided into the pleural cavity and the pericardial cavity. I'm not going to be concerned with the mediastinum. And the abdominal pelvic cavity is divided into the abdominal cavity and the pelvic cavity. So again, this is repetitive. Abdominal pelvic cavity. I would like you to know that the diaphragm is the organ that marks the border between the superior abdominal cavity and the inferior pelvic cavity. And they list here several organs located within each. You have other smaller body cavities scattered throughout the body, oral cavity, nasal cavity. Your ear has a cavity in it, and your joint cavities. These are not particularly important. The membranes, these body cavities, I like to think of it as, let's say you have a box and you want to line that box in tissue paper. And then you want to put something in that box. And you also want to protect that, so you line that with tissue paper. So these tissue paper coverings, not made of tissue paper, of course, are your body's membranes, or serosa. So we have two serosa within these boxes or body cavities, like the thoracic cavity. We have the tissue paper that's going to line the box or cavity itself. This is called the parietal serosa. And then we have the tissue paper that's covering the object in the box, or covering the organ in the cavity. And this is your visceral serosa. In between these serosa, and the principal purpose of these serosa is to produce a fluid that acts as a lubricant to reduce friction between the organs, so that when you do a somersault, your organs aren't tearing each other as they rub up against one another. So the serous fluid produced by these serous membranes or serosa actors reduce friction between organs. Of course, there's various types of serosa depending on which cavity you're located. If you're in the pleural cavity, you have pleura. If you're in the pericardial cavity, you have pericardium. And if you're in the peritoneal cavity, you have peritoneum. Again, you have the tissue paper lining the box or the wall of the cavity, which is parietal. And then you have the lining the organs within these cavities, which is visceral. So you should be able to properly put together whether a given serosa is visceral or parietal, and whether it's peritoneum, pericardium, or pleura. For example, the specific serosa that's lining the cavity where the lung is found would be parietal pleura. Another example, the serosa that's literally covering the heart would be the visceral pericardium. This, again, is supposed to help you see the difference between these two membranes. So in this example, the serous fluid would be the air inside of the balloon here. The fist would be something along the lines of the heart or another organ. So you have your visceral, pericardium if it's the heart, peritoneum if it's the stomach, pleura if it's a lung. You have this tight lining here around the organ, and it's actually continuous with the outer lining, which is lining the cavity wall, which is the parietal membrane. Actual picture of the heart, again, you have that little space in between that's filled with this fluid that's lubricating the spaces between the organs, so that as they slosh around or move around in your body, certainly the heart's always in a movement as it's beating, these organs are not running into one another. The four body quadrants, the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. For these, I would like you to know examples of principal organs found in each. So in the right upper quadrant, your principal organ found here is the liver. In your left upper quadrant, we have the stomach. In the right lower quadrant, appendix would be an easy marker. And in the left lower quadrant, these small intestines are principally located here. We're almost at the end, so we're back to talking about the planes and the different imaging technologies to see those different slices of your body. The three big ones are X-rays, CAT scans, and MRI. X-rays, as we know, are you use at the dentist office for visualizing teeth. They can be used for a chest X-ray to look at bones and other things in the chest which might be dense and come up on an X-ray, like a tumor or a nodule. But we know they're used for things like bones. X-rays are very quick. They're relatively cheap. The one drawback is it does have electromagnetic radiation involved in it. A CAT scan really is a version of an X-ray. These are donut-shaped machines, which you find in hospitals, not in a doctor's office usually. And this donut or tube sits around you. They slide your body through it, and as you slide through it, it can take a picture or X-ray of your body in multiple slices from multiple angles. And a CAT scan, even though it's an X-ray, will give you a better look at softer tissues in the abdomen, but the abdominal cavity and some of the softer tissues is the MRI. Now, the CAT scan, another drawback I should mention is that since it's X-rays, it still contains electromagnetic radiation. An MRI, one advantage is that it's not nuclear radiation, it's a magnetic field, so it's not believed to be harmful. And again, as I said, an MRI is ideal for imaging soft tissues. The drawbacks of these are the magnetic MRI machine is usually there's more modern stand-up MRIs and different open MRIs, but your traditional MRI, it looks like a giant pizza oven they feed you into, and everyone walks out of the room. If someone has a metal plate on them or a metal screw in them, they really can't have an MRI done because of the magnetic field could rip it out of the body. So I mentioned the pizza oven, so some drawbacks of the MRI that it's claustrophobic, it's very loud with all the banging of the magnets going on, sometimes the scans take a very long time, so you might not use an MRI with a small child, potentially, or you might have to knock them out. Fourth type of imaging technology mentioned here is the ultrasound, which is the most inexpensive. You would find these in a doctor's office pretty commonly. Certainly there's no radiation. They're used in obstetrics for a woman who is pregnant. You don't get as clean an image as, or certainly as you do with some of these other technologies, however. I wish you luck.